Hello all. In this PT tip, I'm going to discuss vertigo, dizziness, and balance DIY treatments, plus or minus professional help. As I revise this material for convenience, combining two videos into one, this PT tip is a bit longer than normal. But I think you'll find the material well worth the trouble, as the treatments are highly effective. In these short PT tips, it's not practical or safe to give the actual treatments in sufficient detail. Instead, in this tip and future ones in the series, I will summarize the important things you and your clinician should be working on. At very least, it will tell you if you're getting what your professional should be giving you. But also, I'm hoping you'll realize you can do a lot for yourself. To take a DIY approach, you will need to consult something like my book. My book will give you detailed exercise instructions and how to progress these exercises. But importantly, it will also give you some instances when you should not carry out the tests and the exercises. My website supplements the book nicely with linked videos of models doing all the tests and exercises. But before you engage in any kind of self-treatment, you need to consult your family doctor to get their clearance. They may also want to send you to a specialist like an otolaryngologist or neurologist. But while you wait, and if cleared by your doctor, there's a lot you can do yourself. An important side note: for those with moderate to severe concussions or whiplashes, these tests and subsequent exercises should only be done with an experienced vestibular and concussion PT. Whether that is on your own or via professional or a combination of both, you need to do these exercises very diligently and for quite a while. Some simple self-testing is the first thing to do. Self-testing will tell you which of the exercises you need to do. Test 1 for benign paroxysmal positional vertigo, BPPV. Remember, just feeling dizzy while doing these tests does not mean you have vertigo. See the previous PT tip 16. Test 2. The anterior tandem stance test for balance. In my book, I give you norms to tell you if your balance is considered below average for your age. Test 3. Head movement intolerance and gaze instabilities. These tests will tell you if your vestibular system and/or your brain's processing of it are probably needing to be addressed. Follow the instructions carefully and be gentle. Test 4 for general motion sensitivity. This is really more a set of observations than a formal test. All you really need to do is notice if certain large movements provoke feelings of being off, dizzy, lightheaded, or nauseous. For example, sitting up or lying down from bed, turning in bed, bending forward, looking upwards, and/or changing directions. So, now on to the self-help exercises. It's important to realize that doing these exercises won't immediately relieve your symptoms. In fact, initially they will likely worsen them a bit. But as a general rule, none of these exercises should flare your symptoms up too much. Say max 2 out of 10. Nor, in the early days, should an increase last longer than 1 hour. If they do, back off the duration or the reps until you find the sweet spot. To get good results, you need to be patient, gentle, and very persistent. Dizziness problems take a lot of time to overcome. Fortunately, these are some of the most successful exercises out there. Exercise 1, mindful walking as a sensory reintegration exercise. If you find you are at all dizzy, nauseous, this exercise is very helpful. In fact, it's my all-time favorite exercise. It's a bit time-consuming, but very simple to do, yet incredibly powerful. Exercise 2, for the treatment of benign paroxysmal positional vertigo, BPPV. Do this treatment if the test 1 above is positive. You can do this yourself, most often with something called the modified Epley's maneuver. This is done with pillows on a bed and is much kinder on concussions and whiplashes than the regular version over the edge of a bed. You can find it on the internet, but unfortunately it's usually the unmodified version. If you've never done this test, it's both a bit tricky to know how to perform and to interpret. Instead, I strongly recommend you have a vestibular PT do it the first time and ask for the modified pillow version. Please note, if you do end up having BPPV, it needs to be resolved before proceeding with other exercises. Otherwise, the BPPV will stop you improving with other concussion-related dizziness. Exercise 3, standing balance exercises. Do this exercise if test 2 showed that your balance is below average for your age range. Not only are balance exercises a good thing to do in themselves, but as long as you do them as instructed, they are a wonderful and safe way to neuroplastically stimulate your brain's recovery. Exercise 4, gaze stability exercises. Do these exercises if test 3 shows that you have gaze instability. You also need to be gentle with these exercises. Now finally, exercise 5 for motion desensitization. You'll know if you need to do these exercises based on the things that I asked you to look for above. In any event, wait at least 8 weeks post-injury before starting these exercises. Otherwise, they may flare you. Regardless, do them carefully and gently, one at a time. When not to go it alone. Apart from the cautions and contraindications noted, there are a number of other reasons you may not want to go it alone. If the thought of testing or doing these exercises by yourself is just too daunting, or if you know in your heart of hearts that you're not likely to continue doing the exercises without regular nudges from your PT, and finally, if you need to use a walking aid such as a cane or a walker. Next time, I'll cover the whys of concussion-related vision issues. Keep on healing. April 30th, 2025, revised November 28th, 2025.